Hi there, in today's video we're going to talk about 3 treatment options for men and penis owners who've been experiencing pelvic pain issues. Hi, I'm Kayna Cassard and I've been helping penis owners and couples bounce back from having pelvic pain, erectile difficulties, or other intimacy issues since 2006. Now in today's video, we're going to talk about treatment options, including some that will probably surprise you. And if you find this information helpful, make sure you subscribe. I've got a ton of other content that I like to put out there just because I want the world to have better sex. So make sure you also hit the notification bell so you don't miss anything, because you never know what thing is going to change your life in or out of the bedroom. So what we're going to talk about today are 3 things that are typical treatment options for pelvic pain in men or people with penises. These are pretty standard across the board for most men and most penis owners. They do need at least 2, if not all 3 of these treatment options in order to overcome their pelvic pain and have the kind of sex that they want to be having. So first thing is going to be always make sure to get a medical rule out. So what this is going to a doctor, and usually your general practitioner can refer you to someone because they're usually not going to be this kind of specialized care that you need in order to really figure out what's going on. So go to your general doctor, tell them about the kind of pain and the symptoms that you're having, and they'll probably refer you to either a urologist or some kind of specialist that has sexual health, either certification or some kind of specialty around sexual health. It's really, really important to do that because sexual health training isn't standard in most medical trainings or education practices. And so these are specialists who go kind of above and beyond and get more out there in the sexual health world, not just in medical treatment, but also just the psychological impact, some physical therapy impact. Like these people are typically pretty well-rounded when it comes to sexual health concerns. So seeking out medical professional who has some sort of specialization or is an expert or specialist in these areas is going to be really, really helpful. With this specialist, whether it's a urologist or a sexual health medicine specialist, they will take a look at what's going on, run some tests, get a sexual history. They'll probably ask you about diet, about stress relief, about exercise. All of those things will be considered. And then depending on what your tests show or what they determine from their assessment, they'll either give you some medication prescription, they might give you some diet changes or lifestyle changes. Whatever it is, I would recommend following it to a T because that is what they're there for. And more than likely, the doctors are probably going to recommend you to go to the second thing, which is a physical therapist, pelvic floor physical therapist. Now, this isn't necessary for all pelvic pain issues. However, if there has been some sort of medical condition or problem that's been happening at a medical level, and your body has constantly received this information that something around your penis or around sexual functioning or just even sitting, if you experience pain or discomfort in those areas and you also are starting to avoid certain behaviors or certain patterns of movement as a result of the pain, your muscles, your pelvic floor muscles, this is like the bowl that goes from hip to hip, from pubic bone to tailbone, that's called the pelvic floor. And those muscles might be contracting, or they might be contracting and that's what's causing the pain. So it's gonna be really important to make sure that you seek out a knowledgeable pelvic floor physical therapist. So this is not a physical therapist that just does work on the shoulder. This is a person who is specialized and trained in working with the pelvic floor. They probably also have some sort of sexual health medicine background or sexual health training or expertise, and so that person is even more going to be even more impactful than a generalized pelvic floor physical therapist, because with somebody who has an expertise or specialization in sexual health, they're going to consider a bigger, they're they're going to have a wider perspective on what's going on for you and consider some other psychological or psychosexual challenges that you might be facing and bring that into your treatment plan. Now, the third thing that we're going to talk about is a psychotherapist, and more specifically, a sex therapist. So what a sex therapist is, it's a person who's a licensed mental health professional. And beyond that, like the first two that I mentioned, they have expertise in sexual health and sexual wellness. And they have, again, the perspective to be able to understand psychosexual challenges that might be impacting your pelvic pain, or things that your pelvic pain might now be impacting, like your relationship stressors, how you feel about yourself sexually, so your sexual identity. They might have some insight if they're trauma informed as to trauma from the past and how that might be impacting you. So working with a sex therapist who has that sexual health background is going to be really, really important. And so my clients and I, we work on a lot of concepts ranging from like how they feel about themselves in work into what happened to them when they were younger that kind of laid down the path for messages around sexual health and wellness. We also explore the impact of having their pelvic pain on their sexual identity, and vice versa, what their sexual identity is and how that maybe impacts the way that their penis responds to situations. So there's a wide variety of places to go with it when working with a knowledgeable sex therapist on these topics. And so making sure that you find the right one who's going to be able to know where to look psychologically and figure out what's been going on with regards to your sexual history. It's like it changes things for my clients once they have found me and worked with me as a pelvic health specialist sex therapist. They say that sort of really changes their treatment plan because they didn't realize that there were certain things that were connecting, or certain things that were connected that they weren't connecting because they didn't realize that these things could be influencing each other. So those are the three different ways or three options for treatment for pelvic pain in men and penis owners. So we went over medical, so that's talking with a doctor, a urologist, a specialist in sexual health medicine, a pelvic floor physical therapist, hopefully one that's also specialized in sexual health, and then a sex therapist, and hopefully somebody who is knowledgeable in pelvic pain treatment. So those three treatment options are going to be key in overcoming your pelvic pain treatment. And I hope this was helpful. If it was, please make sure you subscribe, hit the notification so that you get notified about other sexual health videos from an expert, from a licensed professional. And also, if this was really helpful, please feel free to comment as well on what kind of videos you would like to see related to men and pelvic pain or penis owners and pelvic pain. I would be more than happy to answer your questions and to make content that makes you feel like you're getting a lot out of it, because that's my whole goal here, is to help people have even better sexual health lives and relationships. Thanks for watching, and we'll see you soon.